Hi there, I'm Allison Van Schie of Alongside Caregiver Consulting. Yesterday, I visited the X-ray department in my local hospital. I was there because I needed my ankle X-rayed, not because of an injury, likely because I'm aging. Overall, it was a very good experience, but there are a few observations I'd like to share with you. I had checked in at the registration desk and followed the directions to the X-ray department, where I saw many patients sitting in the waiting area, most of them wearing hospital gowns, with their belongings neatly folded into a wire basket that they were clutching. I wondered, am I supposed to change into a gown? There was no staff or even a reception desk present in the waiting area, so I had no formal place to inquire. I needed the information, so I posed the question to the others in the waiting area, and my question was answered by the following. Were you told to change into a gown when you registered? No, I wasn't. What are you having x-rayed? My foot. And then the barrage of comments from the others identifying what they were having x-rayed and confirming that certain areas required a hospital gown and deducing that certain others did not. The conversations continued between those who wanted to share their stories and perhaps even release a little anxiety. And the conversation was very engaging. By this time, I was pretty certain that I didn't need to change into a hospital gown. As we saw new patients come into the waiting room, we recognized a similar question. Do I change into a gown or not? And by this time, the group waiting had developed a unique rapport. And so we provided each new patient with direction. Had they been informed to change into a gown? If yes, then the changing rooms are right over there. One fellow came in and he did not want to change into a gown, and so he had decided not to, although his area for examination required that he put one on. He joked that the x-rays could go through his clothing, so he felt justified in his position. That was until the technician instructed him to put on a gown. It was now my turn to go in and have my x-rays taken. I was required to roll up my pants to above the knees. Why had I worn my skinny jeans? I managed to comply, but it wasn't comfortable. I was surprised at how many pictures were taken of my ankle and foot, and naturally, I started conversing with the technician. One thing that struck me was her comment of how refreshing it was to hear the patients in the waiting room talking to one another and not focused completely on their cell phones. And I wondered, is this the silver lining, or perhaps even the reason there is no instruction in the waiting area as to whether we should change into a hospital gown or not before it's our turn? When we find ourselves needing medical attention, it is important to ask questions, even if this may feel uncomfortable. And speaking of feeling uncomfortable, if there's a next time for foot x-rays for me, I'll be sure to wear yoga pants. They're easier to roll up. Thanks for watching. Take care.